Diseases of the adrenal glands in dogs and cats. Hypoadrenocorticism leads to Addison's disease, and hyperadrenocorticism leads to Cushing's disease. Hypoadrenocorticism is a rare, life-threatening condition due to reduced adrenal hormones, such as cortisol and aldosterone. There are two types, primary and secondary. Primary is from an autoimmune adrenal cortex destruction, and secondary is from abrupt glucocorticoid withdrawal. In primary, we see a decrease in cortisol and aldosterone and an increase in ACTH. In secondary, we see a decrease in cortisol and normal aldosterone and a decrease in ACTH. The signs are chronic vomiting, diarrhea, polyuria, polydipsia, weakness, and lethargy. And in the case of Addison's crisis, we can see shock, bradycardia, weak pulse, and death. For the diagnosis, we can do an ACTH stimulation test, and in the lab findings, we will see hyponatremia and hyperkalemia, as well as increased calcium. And on the ECG, we can see spiked T waves and bradycardia. For treatment, in the case of Addison's crisis, give IV fluids and correct the electrolytes, and give hydrocortisone. And for the maintenance, give fludrocortisone and prednisolone, and dietary sodium chloride. For hyperadrenocorticism, also known as Cushing's, in dogs, there's a chronic overproduction of cortisol due to pituitary or adrenal dysfunction. The causes can be pituitary-dependent hyperadrenocorticism, and 85% of cases are small dogs, or an adrenocortical tumor, and this occurs in large dogs, and it's ACTH independent. It can also be caused iatrogenically through long-term glucocorticoid use. The signs are polyuria and polydipsia, polyphagia, obesity, thin skin, alopecia and hepatomegaly, and panting. For the diagnosis, we can do an ACTH stimulation test, and on the imaging for an ultrasound, we see bilateral enlargement in the case of pituitary-dependent hyperadrenocorticism, and we see unilateral enlargement in the case of a cortical tumor. Lab findings, we see increased ALP, cholesterol and hyperglycemia, and dilute urine. For the treatment, you can give trilostane and have surgery done for a hypophysectomy. Prognosis of lifespan is around 2 years and it varies with complications. For hypoadrenocorticism in cats, the signs are alopecia, hyperpigmentation, keratin plugs, fragile skin, and diabetes mellitus. For the treatment, give trilostane, and the prognosis is guarded to poor. To review the key concepts, for the pathogenesis of Addison's, glucocorticoid deficiency means there's a decrease in gluconeogenesis, which causes fat metabolism and stress tolerance. And an aldosterone deficiency causes a loss of sodium, chloride, and water, and retention of potassium, which causes hypovolemia and decreases cardiac output. And for Cushing's disease, in pituitary-dependent hypoadrenocorticism, we see an increase in ACTH, which causes bilateral adrenal hyperplasia. And in the case of adrenal corticoid tumors, ACTH-independent cortisol secretion causes a contralateral adrenal atrophy.